The following content is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
Hello, and welcome to the Everyday Therapy Podcast, where we discuss everyday topics related to overall emotional wellness. So we're so excited that you're tuning in to chat with us therapists as we help you create positive change by sharing tips, stories, and inspiration for everyday therapy. And we're so excited today.
Our first guest.
And before we get into sharing and introducing the lovely ladies with us, we do want to remind you that at the end, or I guess later on in the show, we'll have a segment called Let's Chat, which gives you the opportunity to call in, and you can be anonymous, no worries, or message us questions on our Instagram or Facebook at Everyday Therapy Podcast. So yeah, any questions that you might want to ask a therapist,
This is your chance.
this is your chance. So anyways, just want to put that out there.
Yeah.
Yeah.
Should we introduce our guest, our first guest for the podcast? And they're veterans. They have their own podcast, which is exciting.
Yeah. So let's get into it. I'm going to use a cheat sheet because they have such cool backgrounds. So
we have so many credentials.
Yeah, so many credentials and letters and all sorts of stuff. But yeah, so with us today we have Anna Zapata, who's a licensed professional counselor, and she completed her Master's of Science in Clinical Mental Health Counseling at the University of North Texas. Go Mean Green. And her background is in working with adult survivors of sexual assault and sexual abuse. Anna is trained in EMDR and is the owner of Dallas Healing House. She is also a registered yoga teacher and frequently incorporates trauma-informed yoga into her therapy sessions. And here's a fun fact for you. Anna, I guess, has a vampire cat. No teeth other than her fangs.
Yep. That's right.
I want to see this.
What's
Can
this
we
precious
get a
cat's
picture
name?
of that?
Chauncey.
Chauncey.
Yeah. She had to get them all pulled except for these two. So when she bites, it's just like a snake bite, like a
Does that happen a lot? She bites?
Oh yeah. Oh,
Oh,
yes,
yeah.
frequently.
She is a
Doesn't feel
vampire
good.
cat.
Yeah.
So, and I'm going to introduce Kristen. So she is an LPC, a licensed professional counselor with her master's degree in mental health counseling from the University of Texas, our alma mater as well. Caw. We're the Eagles. She is a children's counselor and play therapist specializing in domestic violence and trauma. And her dog, Linus, is a registered therapy dog and joins her in most of her sessions. And if I'm not mistaken, you also do animal-assisted therapy with like horses and rabbits
Yep,
and
I do all of that too.
goats. That's so
Just all the
exciting.
animals. Yeah.
Yeah. I was surprised that you didn't send that over. I was like, I know that about her. I need to share it. So, and both Anna and Kristen are the co-hosts for Pop Culture Therapist podcast, a podcast about mental health issues in movies, TV shows, and it's now available on iTunes. The podcast focuses on mental health dynamics in popular today's television pop culture. So I think Here Is Us is on your podcast.
This is us.
This is us.
Yeah.
This is us.
Just coming back soon. So that will be
Yes.
good.
That's exciting. What else have you guys done? The Center?
Yeah, we've done the Center. We did. I think our first one was 13 Reasons Why, which was pretty popular because it was right after it came out and everybody was talking about that show. So
Yeah.
that was a fun one.
And we're coming out with Handmaid's Tale next week.
I know.
Oh my
I'm
gosh. So excited.
Emily, if you're listening, that's my sister. She loves Handmaid's Tale. So
You have to tune in.
yeah.
We had a good time.
Yeah, we did. not a good time watching the show, but a good time talking about it.
It is sad.
The show is a lot.
Yeah, it's intense, right?
Too
Oh,
intense,
yeah, so intense.
So cool. So today's podcast, our title is Myth Busting Therapy. So that's why we wanted to have you guys on, because y'all know all the pop culture myths and stigmas about therapy.
We're
All
the
of them.
female mythbusters. That's my dream.
Here they are, live in the flesh. So, and we also have Whitney in San Antonio. Can we get her on the show? There we go. Hey, Whit.
Hello. Nice to meet y'all.
You too.
Yes, you too.
Yeah.
Where is Whitney?
San Antonio.
Hi.
So she'll call in and join us from San Antonio, which is kind of cool.
Yeah. So, Whit, speak up. We, with you not being physically here,
Yeah.
feel free to
First
interrupt
time
us or whatever.
Doing this.
I'll just jump in.
There you go.
Yes.
Perfect.
Yeah.
So yeah, what are some of the myths that you guys have found in today's television, film, pop culture?
So many. I think one of the big myths that we've seen in TV and movies is therapists without boundaries has been a really fun one.
Oh,
Yeah.
that's such a good one.
Yeah. If your therapist is going to your soccer games, we have an issue.
Yeah.
Yeah. I think the first show that we started with was 13 Reasons Why. I don't know if you guys saw that.
Yeah.
But
Yeah.
Yeah, I
Okay,
watched it.
good.
yeah, Mr. Porter is the counselor in that show, and he does some really unsafe stuff to begin with. But then he goes and beats someone's dad up, and just
Yeah,
is
just your regular
yeah,
counselor
just
stuff.
rescuing the world.
I
No,
always beat my clients.
yeah, me too. That's something that I.
super
I'm
like
just
to incorporate.
kidding. Board, please do not hold
I
me
retract
to
that
that.
statement, actually. Although sometimes you want to, right? But
Oh, yeah.
hold back.
Well, clearly Mr. Porter had a calling to go do this, but that's the thing that's so hard to watch, especially with school counselors, is, I specifically work with kids, and that's the danger of putting out a show where there's no safe place to go to talk to anyone. And then you're showing the school counselor who's supposed to be that person who's super unethical, super shaming, and, ultimately is the final straw, which makes a student kill herself. So there's some damages with that
Yeah.
portrayal.
Yeah.
Definitely agree. Yeah, there was this scene where he's with the character who's suicidal, and he doesn't assess her safety. He looks more nervous than she is when she's trying to tell him about her sexual assault. And I'm like, well, who wants to go to therapy when they see that, right? Like, especially if you're a kid.
Yeah, no, I know that scene that you're talking about. It was so cringeworthy, right? And I'm a naturally empathetic person, but I was just like, oh, when she's telling her story and he's remaining really like stone-faced and almost blaming, right?
Yeah.
I'm
Yeah.
like, oh my gosh, this is like the worst light that you could portray a therapist in.
Oh,
'Cause
yeah.
that's like anything but how it needs to be.
Yeah.
Right?
Oh, yeah.
Oh, yeah, super shaming. He's like, well, what did you do? Did you try to get away? He's like asking all of those kind of victim blaming questions. And it wasn't at all about what the perpetrator did. So she gets nervous and leaves, she shuts down, doesn't tell him anything. So I think Kristen brought up a good point that, like, if you see that in the media and you're a teenager and you think that that's what your counselor is going to be like, why would you want to go?
Yeah, the counselor's like really parentified and has that almost like a parent in the sense that it's, you're doing something wrong versus like this is a safe space to talk about whatever you want to and figure it out and work together.
Yeah, it was really interesting because after that came out, one of my friends who also is an AP psych teacher at a high school emailed us and just really gave a lot of insight about how hard it was for him to watch that show also, and was just really grateful that we were able to kind of send a message of like, this is not what it's like, because he's getting suicide outcries multiple times a year, and it can just be really overwhelming, especially when the media is telling you like, who are you supposed to go to when the adults in your life aren't safe. So that was cool.
Yeah. Get real life experience from somebody in the middle of it.
Yeah, for sure.
Yeah. Cool. Well, what other ones have you guys found? So no boundaries, and then kind of victim blaming, shaming therapist.
Yeah, with no boundaries. We did Silver Linings Playbook. Did you see that?
Yeah.
It's been a while.
It's an old one,
Yeah.
But just to summarize what the therapist does, he goes to a football game, him and client see each other, and then they hang out the rest of the night. Like he goes to his family's house, and like again, there are no boundaries. It's like your therapist cannot do that.
No.
Yeah.
If they are doing that, you have to tell someone.
You have to tell the board.
They say something.
Yeah. I think I have an conversation up front in my first session. Like it's and sometimes the world is small and you can run into clients, right? And to protect their confidentiality, I'll say, hey, I'm not going to acknowledge you, right? Unless you let me know. And I have run into some clients before, but no, I'm
sure
not
we'll
tagged along with them. It's all right.
Yeah,
Let me hang out with you.
This is my opportunity.
So, yeah.
No, that was a big one.
Oh, it's hilarious. And he plays a song that's really triggering. Like, it's almost like TV shows or movies take like these really intense ideas and try to use it as the therapist is going to do it. But that's not what happens. If anything, that would be really, really scary for a client to be triggered purposely by their therapist without any acknowledgement, that was going to happen. So who would want to go?
Yeah, we typically really prep our clients whenever we're going to expose them to something that could be triggering, not just like, surprise, how are you going to react?
Yeah, exactly.
For sure. I think that TV and movies take therapy and turn it into something like the most provocative form of therapy you can think of.
Yeah.
And that's why like multiple movies and TV shows that we've covered, there's hypnosis. And like, I don't know a lot about hypnosis. I'm sure there's a place for it or whatever, but like, I'm like, that's typically not what is happening in a therapy session.
Yeah.
It's definitely not how you should regain memories through hypnosis.
No.
Yeah, so it's not just like accurately portrayed. Like, can you think of provocative? Like, what other things that have you, I guess, come across?
Well, I think that I'm thinking of like Donnie Darko with the hypnosis. I'm thinking of the recovering memories that we did in the center, and then we also did To the Bone, which I'm sure you've heard a lot about.
That's an eating disorder movie on Netflix.
Yes. And they make Keanu Reeves seem like provocative. They're like, he's got these really provocative methods.
He swears.
He swears.
He's so edgy.
They're like, that's how he gets clients to overcome their eating disorder. He's so provocative. And he like says the F word. I'm like, yeah, it's really provocative.
Not accurate eating disorder treatment.
No, hopefully not.
Yeah.
Yeah, and I think sometimes it's shown as like, therapy is not fun all the time, but I laugh almost every session with my clients. I think that's a big part of therapy. So when we sit them down in a movie and it's like the stone cold therapist that's trying to analyze someone, it doesn't have to be like that.
Yes.
That's not relatable.
Yeah, and I think the therapists that we've seen are not relatable at all. They're in like what you said, like a parentified role or an expert role or something like that. They're so inaccessible. And I'm like, when my clients come, I'm like, hey, look, how's it going? Let's sit down. It's not like...
Yeah, it's very casual and trying to make it approachable. I wear casual clothes and kind of slouch a little bit. Might drop a F-bomb or something.
Exactly.
Right. We're just normal people.
Yeah.
Yeah.
Has anyone actually watched Bob's Burgers?
No.
I've heard of it.
I've seen a couple
Tell
of
us more.
There's a counselor on there. I was just going to make a joke that he's probably one of the most accurately portrayed
Really?
therapists. He's just like super quirky, and he like gets out his little like grief dolls, and he's just like the most approachable little cartoon ever.
I love that.
Yeah. Sounds like he would be better than what we've seen. What we've done lately.
Yeah. Oh gosh, I'm trying to think of the movie that I'm thinking, but I feel like a lot of movies, they're in their big like leather chair, right,
Yes.
with a bookcase behind them, right, and then taking notes, and they're typically like males, right, like white, older.
Yes.
Oh yeah.
And yeah, that is so not the case.
Yeah.
Oh.
And most of the time, the clients are coming in with like severe mental illness. Like we've seen a lot of like schizophrenia that's kind of spiraling out of control, unmedicated bipolar disorder, stuff like that.
Yeah.
And I don't think it shows people that a lot of times therapy is about life transitions. It's about divorce. It's about a breakup. It's about, leaving college and starting your career for the first time. I mean, there's so many different things that counseling can be good for besides like severe
That's
mental illness.
Such a good point. Yeah, I think therapy is more on a spectrum of like severe pathology to just like normal everyday issues that you're trying to overcome, and wellness, emotional
Definitely.
health. Yeah.
Well, and therapy doesn't have to just be sitting down. I mean, you guys are all yoga therapists, and that looks so different. I do play therapy with kids. I'm constantly on the floor or walking in a field having a sword fight. Like, it doesn't have to be this cold, quiet atmosphere. It can look so
Sometimes
different.
that doesn't work.
Oh, no.
Yeah.
I don't like doing that.
Yeah. Julian, you were doing walking.
Oh yeah, I did. With one of my clients, like walk and talk therapy.
Yeah.
Which is just, it's cool to meet clients where they're at, because it can be so intimidating. I get it, to come in, sit across from somebody, make eye contact, and then like spill your deepest, darkest secrets. Like, no, don't sign me up for that.
Yeah, exactly.
So I had one client, teen client who was, it was just especially hard to get started. Like the feelings and thoughts are so overwhelming. So, I was like, okay, this isn't working here in the room, So she liked being outside. So I suggested that, and we, there's some things to take into consideration. And I told her, hey, I can't promise confidentiality. We're going to do our best to kind of find like spots along the way where there aren't a lot of people. But what I, really realized about this was that, we're walking side by side. And that's just, to think on a deeper level, that's how I view counseling, right? Like, okay, it's not me in the expert position, but I'm helping walk along as you learn to figure out what you need. I might, poke your, I guess, not poke, that's a weird word to say.
No poking, Julian.
I don't know. Where did that come from? Anyways, okay, let's redirect. Oh my God, sorry. Now I'm like super embarrassed right now. All right, anyways, gonna just pretend that didn't happen and talk about just guiding them in the direction. And, what I noticed was when, we were walking at her pace and she didn't have to look like me right in the eye, she could really just open up, and it wasn't so overwhelming to talk about things. So yeah, just another modality that you don't have to come in and like lie on the couch.
Yeah.
But I do have some clients that like to.
Tired after work.
Yeah.
Can I lie on the couch? Sure.
Yeah,
Why not?
no.
Take off your shoes.
Yeah.
But therapy is such a creative process, and I think what we're seeing is the opposite of that.
Yeah.
It looks medical, sterile.
Yeah.
Definitely.
Well, that seems like what it was for so long,
I agree. Yeah, we have such an outdated version of what counseling looks like, and we've had so much more research come out of just all the different things that it can be. But yeah, we're still kind of stuck in this 1950s, people laying on the couch behind you and someone's taking notes about you. It doesn't look like that.
Yeah. And I think another thing that we've seen, like with what I was talking about earlier, like that severe mental illness type thing, is like these clients would not be in an outpatient setting. Like some of the clients that we have seen on these TV shows and movies, I'm like, they don't need to be in outpatient.
They need to be in a
counseling.
hospital.
Yeah, they need to be in a hospital.
Oh, that's a good point. Yeah.
Yeah, and so I'm like, if you think that, you're going to be experiencing some of these symptoms, hallucinating things that tell you to go kill people or whatever, and you're going to go to an outpatient that's not the
one hour a week
of therapy isn't going to cut it.
Help.
Yeah.
It will make things more dangerous.
Yes, so we've seen a lot of that. I'm like, well, this is not appropriate at all.
Good point. Very good point.
One thing that always keeps coming up when we started planning out which shows we wanted to do, and we're kind of alternating on our podcast, new shows and older shows, every other week we're trying to. And it was so easy to think of all of these horror movies. All the stuff came up, Girl Interrupted, or what's another?
I'm thinking of Split.
And, yeah.
They're scary, it turns into murder.
Yeah, they're really capitalizing on severe mental illness as a type of horror movie. So you're looking at that, and if you are experiencing hallucinations or delusions, how scary will it be if this is the example that you have of what will happen to you? You'll get locked up or thrown inside a psych ward with nothing else, just walls. And it's so damaging, I think, to have that, and there is a line of entertainment versus what is actually reality, but it's preyed upon easily.
Absolutely, and it just furthers that stigma. Like, so how do you balance in pop culture, you know, of having like a good horror movie to where you have some aspects of that,
Right.
but it just, there's no way to really portray what reality is within that.
Definitely.
Yeah, it takes it way too far. I think one of the first movies that we did on Pop Culture Therapist was
Hereditary.
Yeah. And that was kind of like a horror film. It was a smaller film. It was great.
It was amazing.
Yeah.
Go see that.
Big
baby.
fans. Okay, I haven't seen it, so.
But again, it made something like DID, which dissociative identity disorder, which a lot of times these people are not dangerous. It made it into like she's the killer, and you know she's like
wrecking havoc on the whole family because
Burning
their
things
safety.
down,
Lighting their children on fire.
That is a disorder with a lot of stigma around it.
Definitely.
Normally called, or it was in the past called multiple identity disorder.
Yeah.
And that was like what Split was too, which we haven't covered,
But we will.
To come.
More to come.
Yeah, and that'll be really good, Anna, because you've worked with a lot of clients with DID, right?
Yeah.
So for you to be able to really...
Yeah, and they're not dangerous. I mean, the people that I've worked with are not dangerous. They've just been through some really, really complex trauma at a young age, and that's kind of how their brain learned to cope with it.
Yeah.
And so, like, when we see these movies, I'm like, that is just so far from reality.
Yeah.
You know?
Yeah. Yeah. And hearing that, I feel like more people hearing the backstory of how they got to that point gives you a lot of empathy, which is not portrayed in the movies and film.
Yeah.
Yes.
Or it sometimes even is, and it's capitalized on, you know, like, oh, you know, they were a neglected child, so obviously look how they turned out. They had to be crazy. No, I've worked with a lot of children that are neglected, and they still have very successful lives as an adult. There's just all these portrayals of, like, if this happens, then this is the outcome in these, like, TV shows.
Hurt people. I'm like, that's not true.
Yeah, it's true.
Who made that up? Who made that up? You're wrong.
Well, I really love what you guys are doing with like the Pop Culture Therapist podcast, because I think like all these like portrayals in media match up with such a lack of information about therapy and what therapy is. So I think that's very cool that you guys are shedding light on like what actually therapy is.
It's been like the most fun I've had in my whole life.
Yeah, I think it started as kind of like a fun creative side project for us, and then we were like, this is really a lot of advocacy that we're doing.
Yeah, and it's just been so cool, the people that have reached out to us with a lot of kids that are in school studying this stuff that just wanted to say thank you. I don't know, we're just like messing around and doing this, but it's been so fun.
And we get to watch some cool shows.
Oh yeah.
Yeah, I think it's so cool.
Except self-care, but helping others at the same time.
Not Handmaid's Tale.
That was not self-care.
Don't recommend
That's a lot of hours to put into that as well.
Oh, yeah. Especially if one of us has seen something and the other one hasn't. Like,
okay, you got to go back through and watch it together.
Some
and
people are asking us to do things that have like 9 seasons. We can't.
Sorry, guys.
No.
We can't do it. And so much information to fit into 1 hour that it doesn't come off very eloquently.
No, but what we've kind of started doing is just picking out certain scenes where either their mental health struggles are shown more, or there's a therapy session that's shown. Like we did that with Sex and the City, which is 7 seasons. So there was no way that we were going to be able to watch all of that before we did our show. So we just picked out like a scene with Carrie and her therapist that she goes to for a breakup.
Yeah.
Tell us about that one. What is some myths about that one? Have y'all already released that one yet?
Yeah,
Okay.
this week. Yeah.
Okay. Yes.
Can you give us
We would tell you anyways.
Sorry, you have to go watch it now.
We're going to take a break.
So in this episode, she goes to a therapist, Dr. G. Dr. G.
We had a Dr. G in school. Do you remember Dr. G?
She was actually really cool.
Yeah,
Shout
she
out
was
Dr.
cool.
G. Hey,
Yeah.
Dr. G.
I totally forgot.
This Dr. G was not cool.
No, that's like their first session, and Carrie's kind of talking to her about the kind of guy that she was dating, that she broke up with. And the therapist is like, well, this is her first session. Like, I just want to reiterate.
Okay.
It's like an intake
That's the
session.
important part.
Yeah, that's the important part. And the therapist is like, well, what kind of men do you usually date? Or tell me about your other boyfriends. And Carrie kind of says something. And then the therapist is like, so it sounds like what they have in common is you. like pretty much being like, you made a bad choice multiple times, but it's their first session.
Ouch.
And we were like, there is no rapport build prior to this challenge. Like,
Which is so important to be able to trust somebody who you're sharing everything with.
yeah, she just kind of looks at her, and Carrie's like you can tell she's immediately put off by that.
Absolutely. Who wouldn't be? Like, there's a difference between confronting gently many, many sessions later and then like attacking.
The first session.
First session. And like exactly what we were talking about, that kind of like expert role, like her therapist just kind of leaning back. She's like, you're the problem. Like, it's like, oof, that felt harsh.
Yeah, it was harsh.
So again, therapy seems really scary when you see something like that.
Yeah, for sure.
It's so fun too because we've been able to pick out certain characters and kind of get an idea of how we would work with them if they came into our office.
How fun.
Oh yeah.
Yeah, that's what we've been doing lately with our episodes. We'll be like, well, how would you work with them? How would you work with them? Just to kind of bounce some ideas off each other.
Yeah.
And Kristen and I have different approaches.
Definitely.
And so it's kind of interesting to hear what she has to say. Yeah.
Yeah.
I'm right.
She's wrong, but it's really interesting.
Yeah, I think that, that speaks to like every therapist is different. So like we were saying the last episode that if you like find somebody that you don't like keep trying because there's different modalities and ways to work with a therapist.
Yeah, and I think it's so easy to be scared. You go in and you find someone that just didn't feel right, and then you don't want to try it again. But it's so worthwhile to find someone that you really connect with, because so much good healing and love can kind of come out of that.
Yeah,
it doesn't have to feel intimidating.
For sure. And I think it is. Y'all can speak to this too, but the first time somebody comes into my office, you can just tell they're so nervous. And that's the first thing I say is, how nervous are you? This is really hard, huh? Yeah. Because it is just so scary.
Yeah. No, and I actually picked the brains of some of my clients. They're willing to share that it was a lot harder than I expected coming in.
Therapy.
Okay. Yeah. But then they're like, but it got easier with time. And they're like, no offense, Julianne, it was hard at first. I was like, I get it. Like, yeah.
And that's like what a lot of a first session is. It's just normalizing that experience. Being like, it's tough. Like,
Absolutely. Yeah, a client the other day was like, sometimes I'm really excited to be here and sometimes I really don't want to. That's so normal. And we're just going to go at your pace. If I try to rush you through stuff, that's not helpful. That's not going to do any good, but we'll just kind of take your time.
Yeah, meeting somebody where they're at and like as a client, knowing that going into it makes it so less intimidating.
Yeah, but people don't know that. Like, look at that. Look at what we're seeing on TV.
Yeah, of attacking the first session or
and
you
can
were
tell
raped?
that Carrie's
Let me
so nervous.
blame you.
Yeah, and she doesn't say anything to kind of put her at ease.
Later, but just that like portrayal of on the media, like you're going to go into therapy and someone's going to try to like figure you out, or tell you what's wrong with you, or like confront you right off the bat. When really, our goal is always to make someone feel like comfortable and safe and like relate to them right off the bat.
Yeah, because how else are you going to do any work? Like if this isn't a comfortable, safe space for you, like we're not going to get anything done. You know?
Yeah. And it's always about the client and their goals, right? Like in the first session. So it's like, well, I might, you might be saying something and I might think that there could be some growth in that area, but that's not for me to decide, right? So if you want to come in and work on, I guess, your anxiety and really I see that the anxiety could be stemming from some unhealthy relationships, but right now it's all about how you're functioning at work. Okay, we're going to go with that, right? Because ultimately, when you feel in control and safe, there's growth that can be made. And then maybe I can later down the road kind of inquire about your relationships. But all that to be said, right? Like the client is control. Like we're not the expert. They're the expert of themselves.
Yeah, and I think it is helpful, like, as a client, like, I've been to therapy, I'm in therapy myself, like, sometimes I don't see things, and so for somebody to gently point that out and be like, hey, did you see that thing that you're doing all the time? Oh, yeah, okay, I see what you're talking about, or no, I don't, I'm not ready for that, no, thank you. I think that that's super helpful, and I think people want that, ultimately, to be, like, honest with themselves and move through certain things.
Yeah, exactly. And the way that you even brought that challenge up or that confrontation is like your body language is like, hey, like, like it's just a little softer than being like, you messed up, Yeah.
Yeah, and as we're talking about this, I had a client share something. She's super insightful. She's a teen, but I don't know, I'm like super impressed with her. Kind of along the lines of what we're talking about, a myth about therapists being the expert and kind of like advice givers. Like I think that's a common one, right? That we tell people what to do. But, I guess the way that she described her experience, and she said that I could share this on here, was that
She was really excited that
Yeah.
Julianne was going to share.
Yeah, and I really enjoy working with her. Anyways, she said that she thinks therapists, she defined therapy as, therapists aren't there to tell you what to do. They are there to help you realize what you've needed to do all along.
That is some wisdom.
Yeah.
Yeah, wow.
Yeah.
It's very true.
So,
Yeah. I think speaking to, like, we already all have it within us, so it's just tapping back into that and finding our own strength that we have. We all have.
sometimes like our self-confidence gets muddled along the way for different experiences, different people, right? So having the space to kind of rediscover like what's been within us all the way.
Yeah, exactly. Yeah.
And then what are some of the other myths that we've heard from our clients?
Ooh. Okay, we have some good ones on here, but do you all have any before we dive?
We hit the main ones.
Okay.
Yeah.
And those are some ones that I haven't really thought of, like off the top of my head. So
Ooh, this one I think comes up a lot. Talking to someone about my problems won't help me. I can fix them on my own.
We've been talking about Sex and the City.
Yeah.
Okay.
I love it.
This is exactly what Carrie says in this episode. Is she's like, I'm more of a do-it-yourself, fix your own problems kind of girl.
DIY therapist.
Yeah, exactly. I was like, no, you DIY like crafts and stuff. You don't, like,
Do not
your
DIY
mental health. Yeah. Don't DIY therapy, Carrie.
It's hard to take that step because I think there's a lot of fear behind that initial reaction, you know, and that says so much about vulnerability and what it means to put other people in a space to help you. Like, I think letting go of that control over yourself is really scary for some people. So I think that might be the root of where a lot of that comes from. And I just think that part of that is you won't know until you go. Like, you have to try it. I think everyone should try therapy at least once in their life and just see what you think, because it's not how it looks on TV.
For sure.
No.
Yeah, I was really happy that our graduate school program made everybody who was a therapist go to therapy so they could fully experience it.
Absolutely.
That was a really cool experience.
Definitely. Because I think there's this kind of bigger cultural idea about therapy that you're weak if you go to therapy. And we saw a bunch of the characters in the shows we've done that feel weak when they go in. And Kristen and I were talking about it and saying, like, I mean, especially at the agency that I was working at, that was a rape crisis center. I was like, these women that have come through my door are the strongest people ever. I mean, to have been through the crazy stuff that they have been through and to still be standing and coming to therapy is, I mean, they're the strongest people ever.
Oh, yeah. One of my families was living in a shelter, and now Mama's in law school. Like, it's incredible what these women do. So you are not weak when you go and get support.
Yeah.
It's brave.
Yes. The exact opposite, brave.
Yeah.
For sure.
Yeah, and I mean, I think too, there's, you know, with self-help I love that that's becoming more of a focus in society, and all these books, right, and podcasts, right, and all this stuff.
Wait, what?
Yeah, not to, but there's an element to therapy that is, I think, so healing, and that comes down to the relationship, which can't be replicated in a book, right? So when we talk about what makes like healing, and you know, and healing being the sense of feeling like your best self happen, it is being able to share it with someone, right?
Yeah.
You know, so I have a lot of clients that come in and they've said this, you know, like, I've tried everything and you know, and I'm a failure. And so much it's that criticism that like keeps them stuck in these cycles. And when they share it and they can receive some compassion and have me sit there with them, right? Like, there's just, you can't get that elsewhere.
Yeah, you can't DIY it with a book. And I've had people come in before and be like, yeah, I've read, some books and I've processed through my trauma. I'm like, oh, no, you have not. Like, you are not going to process through your trauma with a self-help book. You're not, because it's not the same relationship.
Yeah.
I think I see a lot of that stigma in the parents that I work with. Like, they're coming and they're so nervous and they feel so ashamed because parenting is something that people have done for thousands of years. Like, they should just know how to do it. But parenting is an impossible job, and it is so normal. And you're not going to read a Pinterest article and understand or really know how to apply that article to your child, And sometimes it's so much further beyond the parents, and the kid really, really needs a different type of support. So there's so many different things, but there's so much shame in parenting. Like, the second that kid is here, it's an impossible
I'm
job.
a bad parent. Yeah. There's something wrong with me. Yeah, and parenting is so hard.
Oh my gosh.
Like, I want all the help I can get.
Yeah, exactly.
Whenever I get to that point.
Yeah, no, I frequently,
the more the merrier.
Yeah, tell my parents, I'm like, I don't envy you. Sorry, in a way, right? Because I think it's the ultimate act of, like, being out of control.
Absolutely,
right?
that is for sure.
Yeah.
So another myth that we've heard is once you start therapy, then you're in it forever.
Why not?
Kristen's like, sign me up.
Yeah, let's take both sides to that. Yeah.
No, I mean, obviously, no, you don't have to be in it forever. But I think, like, if you are able to do that, why not? Like, really?
Yeah, having that self-awareness and that relationship, and all the things that go along with therapy, insight.
Yeah, and I see people, like, sometimes they're good to go and don't see them for a couple of months, and then they have this big life event, and it's really nice to have someone that you trust that you can call when something goes wrong, because life is going to happen and challenges are going to come up. And if you have a relationship with a therapist already, it doesn't mean you have to be seeing them all the time, but you can say, hey, this thing just happened or something popped up, can I come in?
Yeah, I think even just having that security, because I'll have old clients reach out to me and say, hey, can I set up an appointment? Something's going on. And then I won't hear from them for a while. And I'll hear back and they're like, oh, I'm fine. Everything's good now. So I think just having that, it's like a security blanket in a way, like knowing that they have that. And I didn't realize that I was doing this, but from the start of my session, I kind of lay out how I'm going to work with somebody and kind of give them the option. So I think I was eliminating this myth without even knowing it. But I'll say, I typically see somebody for 8 to 12 weeks weekly, and then we kind of see where we are from there. And then we might go to bi-weekly, then monthly, and then maintenance, whenever you need me.
Yeah.
And I think a lot of therapists kind of see it in that way. They're not looking to keep you forever and just keep getting a paycheck by any means. Our goal is for you to fly the coop and be able to have those skills.
Yeah, there's a play therapist in DFW, I think, that says something like, I'm trying to work my way out of the job. But I think there's so much security that comes in having that person there who knows you, who gets you on a deep level that sometimes your friends and family don't get. Like, that's a luxury. So if you can do it, why not?
Yeah. And I've had to do kind of the opposite of that too before, when people are like, okay, let's get going. We'll be out of here in 10 sessions. I'm like, ooh, we got a lot to work through. Like, and especially complex trauma, that kind of therapy is, research says 1 to 3 years. I mean, it can be a commitment.
It's depending on what's going on.
Exactly.
For sure.
And so some of that is like, yeah, but it's okay. Like, it's okay to be in therapy for 1 to 3 years. It's normal for what you've been through.
Right. Yeah.
And I think that's an issue at a lot of agencies, is they put on a number of sessions, like especially these high trauma clients that have had so much in their life. And they're like, okay, you have 8 weeks. Like, what are we going to do? We're still building a rapport, especially with children. Like, I'm a stranger to these people. Like, so you have to go with how your body's signaling to you how you're feeling.
Definitely.
Yeah. And I think to empower our listeners who are thinking about therapy, if they've never done it, asking up front, right? And then also knowing along the way that you can talk with your therapist about, hey, I'd like to scale back a little bit, or, and we can say, hey, yeah, I think, absolutely, this seems like you're in a good space. So knowing, once again, that the therapist isn't in control. Yes, we have experience and the expertise and recommendations, but ultimately you're in the driver's seat, right, of your treatment. So one thing that I do want to leave a little bit of time for, and we could talk about this forever. We love it, obviously, right? But we just have a few minutes left, and would love to get to our Let's Chat segment.
Yeah. This is where listeners can call in and ask questions of a therapist. So let's see, Ziggy, can we get that number up there? Cool. Call in now. I love it. So loud.
So 972-884-0816.
Yes.
If we happen to have anybody that wants to call in. And ask
Or you
us-
can direct message us
Yeah.
on
Oh, you
social
can-
media.
Yeah, you can be anonymous. We do have some questions from our social media that we can answer.
Yes. The first question I love so much. What's behind all the dollars I pay? Why is therapy so expensive? Oh, what a good question. I love it.
Yeah, no, I think that's a real question. It's an investment in all sorts of ways, right?
Absolutely. And I do think therapy is you get what you pay for.
Yeah.
There's a difference between $40 therapy and then $120 therapy.
Yeah. And we're all pretty consistent. Like we're, basing our pay on other people in our area and on our level of expertise, our level of training, certifications, all of that as well. Because I know whenever I started and I was just an intern, I think I never received money for that. But the agency I was at did. They charged $50. And I had a lot of great supervisors that I collaborated with. And so it kind of felt like there was more heads in the room. There's a lot of agencies that are nonprofit and do have like lower cost therapy as well.
Yeah, and at an agency or a nonprofit, you're going to be on a wait list for a long time. Sometimes you have a session limit and things like that. So that's part of what you're paying for too, is you're paying for a spot to be seen quickly and to be seen regularly, and you can come as long as you need.
Yeah, and we're keeping up with basically the market rate with what insurance companies are telling us. It's a little bit out of our hand. I think I would love to give free therapy to all the kids of the world, but I can't. I can't, and I have to value my time and your time, and it is an investment that if this is the time that you're taking to value yourself and really put yourself first, that kind of comes with the territory.
Yeah.
Yeah.
Whitney, you had a good frame of mind around this. Do you want to pop in?
Oh, sure. We were talking about it earlier, just what does all the overhead cost of just coming from the private practice standpoint, some of that money is software, rent, and prepping for clients and writing notes and making sure that we're continuing our education and case concepts and in order to maintain the quality of care. A full caseload for a private practice therapist is 20 to 25 clients. So part of that, what you guys were saying, being able to get in and be seen regularly and have quality of care. Oh, and I was also saying, even I was hesitant, I don't want to pay $125 to go to my therapist. But then I was kind of thinking about, calculating out, that's, what a massage would cost, or, 4 months of therapy is $2,000, would I pay that to go on a vacation or to a yoga retreat? Probably. And therapy can have positive effects on my mental, emotional well-being. So just seeing it as a worthwhile investment, and then also looking into those other resources if it's not within your price range.
Definitely. I think that's such a good point too, because I'm still using, things that my therapist talked to me about when I was in college, and that was a long time ago. So it really is an investment. This is a long-term way of changing how you've been thinking about life.
Agreed. Yeah. And we're not putting the money in a bathtub and bathing in it. This is a reasonable. I think our prices are pretty reasonable. Yeah. We're not rap star rich. So.
Yeah. For sure. I think. Oh, shoot! This thought just escaped me that I wanted to say about this. So never
Might
mind.
come back around.
Yeah.
We'll see. Another question that we had. Let's see. How can you tell the difference between stress, anxiety, and panic attacks? It's a good question. And I can speak to that first, and then if y'all want to add anything. But I think stress, we have a natural stress response to like a threat. And that can be really positive. There's an optimal level of stress that pushes us to complete a deadline or finish a paper or something like that. And then anxiety is more of like an ongoing, like there might be a situation that I pinpoint and I can say that that's the situation, but it could go on longer. And I think if I was to identify feelings with stress versus anxiety, like stress would be frustration and nervousness, and anxiety would be fear, worry, sometimes terror. Panic. And there's different levels of anxiety. So there's like mild, moderate anxiety, which might be like free floating. And then there's acute anxiety that hinders you from functioning in your job or with friends or going out in public or whatever it is. Everything in between. Do y'all want to add anything to that?
Yeah, I have one quick way to view this, and then we'll have to unfortunately wrap up for today. But I like to think of stress as you have a lot going on. Okay, a lot going on. And anxiety is you have a lot going on and you can't handle it. There's this belief that I can't function. So that's just how I make that easy determination. And so I think, because stress and anxiety is so interchangeably used, it's, important to know the difference.
There's
so
a
that's
myth
a great
with
question.
that too. Yeah. Saying like, oh, I'm so anxious, or I'm about to have a panic attack, whenever that might not be legitimately true, like on a diagnosable level,
Yes.
Yeah.
And a panic attack is like, I'm going to die is what it feels like.
Yeah. If you've had a panic attack before, you've had a panic attack because you feel like you have the physical symptoms of, dying. You can't die from a panic attack, but you feel like your throat's closing or you're having a heart attack. A lot of people show up at hospitals saying, I'm dying.
Yeah.
Like you're having a panic attack.
Which is really scary. But once you have the power to know what's coming and how to handle it, you can get it under control. Absolutely. But more to come, because I know you're our anxiety expert, and so we'll make sure to talk more about this. But unfortunately, this is so cool that we can chat forever, but we're about out of time.
Thank you guys so much for coming.
Thank you guys for having us on.
Check out our podcast.
Yes, you can find them at, tell us where we can find you.
Yeah, we're all over the place. We have a website, popculturetherapist.com, and we are on Facebook at facebook.com/PCT podcast, Pop Culture Therapist. So
Love the acronym PCT.
Yeah, exactly.
Yeah.
And Handmaid's Tale is coming out on Tuesday.
I can't wait for that one.
Thanks.
Yeah. So thanks so much for your time and being here with us. We'll say before we close that next week we're super excited to talk about the Enneagram, which is
It's very old.
Very old, but
Personality
actually
assessment.
not new at all. Personality assessment, which JC and I love.
Yes.
Yeah,
oh my gosh, we're always talking about it. It's almost embarrassing. Are y'all familiar with it at all?
No. I was like, I want it.
Yeah. You'll have to listen.
Yeah. Anyways, I think we're going to be cut off here. So stay tuned.